All right, well, good morning, everyone. Mark Wilson here again in Tallahassee, and we appreciate all of our Florida Chamber members dialing into our webinar this morning. We have a very special guest with us today, someone who's become a household name throughout Florida, our Surgeon General, Dr. Scott Rifkes. And what we wanted to do here is quickly level set what we're going to work on today. Where we're going with this is the first thing we're going to do is I'm going to walk everybody through what to expect today. And we're going to quickly go through really some background for all of you. Obviously, this Monday, we'll have had Mother's Day right behind us. We've already tested 500,000 Floridians. I think we'll hit that number today, just to be clear. But this coming Monday, we'll be 1 week into phase one of reopening Florida. And one of the most requested questions that we've been getting from members all over Florida has to do with, what to do about safety and health precautions, the CDC, EPA, the Surgeon General, the Department of Health. And so as Dr. Rifkes and I were talking the other day about it, he was just so kind and gracious and agreed to give us, invest some of his time with us, really answering your questions. And so on screen, what you can see here today is just like all of our Florida Chamber webinars, we try to answer your questions. You're the reason that we're having this webinar today. And so in terms of what you all should expect, we have hundreds and hundreds of chamber members on the line with us today. And Dr. Rifkes, I know you're listening in right now. And just for your background, we have the very biggest companies in Florida are on the line with us. We also have, companies with 1 and 2 employees. We have companies in Pensacola, all the way to the Keys. And so the Florida Chamber is really a diversified mix of every industry and size of employer. And so I'm anticipating the questions that are going to come in will be just as varied as our members and their geographies and their sectors as well. So what we're going to do is I'm going to start off actually by being a mirror for you. You've answered a lot of survey questions heading into today. And what I want to do is I want to give you the answers to those questions. We also have a series of webinars coming up. We're going to continue this series. We have one coming up next week, actually, with EPA that many of you are already registered for as well. Also, the Department of Health has the best data available anywhere. We've also put a scorecard tracker up. I want to show you what that looks like. We also have 235 local chambers of commerce in Florida that have been working with me over the last 5 weeks on weekly webinars, and they've helped us develop a local framework of how to implement the White House, the CDC, and Governor DeSantis' guidelines actually at the local level. We have 412 cities and 67 counties, so it's vital that we execute this right at the business level and at the community level. And then the bulk of our time today is going to be the Surgeon General answering your questions. In terms of how to ask questions, it's real simple. On your screen, there's a Q&A feature. And if you just click on the Q&A button, you can actually go ahead right now and start asking questions. When we get to the Q&A portion here in a few minutes, I will serve as the moderator. And I will just take the questions as they come, and I'll just ask them of Scott, and then Scott will do his best to answer them. As is always the case with Florida Chamber webinars, you will likely have more questions than we have time for, but that doesn't mean we're not going to answer all of your questions. So if we run out of time today, the Florida Chamber team will take it upon ourselves to get back to you. The only caveat there is if you ask a question in anonymous mode, we obviously don't know how to get back to you, so just keep that in mind if you take that route. So I mentioned the Department of Health data, and we're so grateful, I know Governor DeSantis is too, to have Dr. Rifkes and the Department of Health to be able to give us real-time daily data in every county. And I simply wanted the members of the Florida Chamber to know, several years ago when the Huizenga Family Foundation donated $1 million to our foundation, and one of the things we did is we created a Florida scorecard with it. And recently we've pivoted to give you the kind of data that you would want to know every day. So we're on day 67 now since our first case in Florida. And what you can do here, you can see how many cases we have. The 14-day average number of new cases in Florida is going down, which is exactly what Dr. Rifkes has been asking us all to do. We don't have time today to do this, but if you wanted to, on your own time, go to the floridascorecard.org. In the top right there, you can see where it says View County Data. Just go to the drop-down box, and every day you can see the numbers and what's happening in your county where you live or in the county where your business is. Now, I want to give you just a speed round here of data because I think it's really important. I know many of you employers, you feel like you're in this alone, and you're wondering if you're the only one that feels a certain way. And I can tell you right now, I'm getting dozens of calls every couple days, and I can tell you you're not alone, but I do want to give you some quick feedback. So the Florida Chamber does voter polling on a very regular basis, and here's our most recent poll. This is of voters in Florida, and I think what's important, and Dr. Rifkes, I don't know if you and I have talked about this number before, but what this basically means is that 80% of voters in Florida are still concerned that they or someone in their immediate family is going to become infected with this. And said differently, only about 20% of Floridians are not concerned that somebody's going to have this. And so there's still a big concern out there relative to contracting the virus. That matters because now I pivot to, we asked chamber members what their concerns are relative to the restart of the economy. And what I would want to point out here is members of the Florida Chamber are 4 times more concerned that their customers are not going to come back than their employees not coming back. And so again, hence why health and safety are going to matter so much to the economic recovery in Florida as well. So in terms of what you told us coming into this call, Dr. Rifkes, I know you have, I believe you have these ahead of time, but I want to just quickly go through them so our entire membership that's on the call today is seeing the same data that you're seeing as well. So there was this question here, do you know if your business is considered a high, medium, or low risk by OSHA? All I want to point out here is only about 1/3 of you know how your business is categorized, and over half of you are either unsure or you said it doesn't yet apply to you. Fastest way for you to find out how your business is actually considered by OSHA is just email our senior safety manager, Diego Sanchez, and he'll go offline with you and he'll help you figure that out and walk you through how to look that up in terms of the OSHA risk levels. And Scott, I imagine much of what you're going to talk about today will actually help those businesses who are trying to find out what they can do to keep their employees and their customers safe. So this all kind of goes hand in hand. But Diego's there as a lifeline for everybody, and that's his email address, dsanchez@flchamber.com. We're happy to help. Is your business taking the temperature of employees? So about 1 in 5, fewer than 1 in 5 of you are. Again, Dr. Rifkes, I know you're going to get questions about this later on. So good to know where people are right now. What about customers? Only about 10% of our members are taking temperatures of customers. And so, Scott, we're looking forward to what you have to say about that and what are best practices. Is your business closing common areas? So, and again, about 1/4 of you are, about 35% of you are not. And again, 12% are either unsure, 29% say it doesn't apply. I don't know if it doesn't apply because you're not back in the office yet or because you don't have common areas, but I wanted Dr. Rifkes to get a snapshot here of what our members are saying right now. Do you believe you have access to the right cleaning and or disinfectants? The good news is it looks like this is not an issue. Dr. Rifkes, I will tell you there is a big difference between the larger employers in Florida ability to answer yes to this question and the really small company, 2 to 10 employees. I'm getting them telling us they don't even know what's required or where they can get it from. So, we have 2 different challenges on our hands here. Does your company have enough PPE to last 2 weeks? Only about half of our members said yes to this question. And so, again, I know, Dr. Rifkes, you've got some thoughts on this. And do you believe your business meets the minimum safety protocols when you put CDC, OSHA, and EPA back together? Again, the good news is about 60% of you, feel that you do. If you want to be certain or you want to know, if you're saying, wait, what's the CDC and what's OSHA and what's EPA and what are these guidelines? Again, the lifeline for you, our safety manager, is happy to help out there, Diego. And Dr. Rifkes, I'm sure the Department of Health is standing by and happy to help with this as well. So it's important that we all know what the guidelines are and how to meet them. And then quickly, are you concerned that if you follow all the guidelines that you still might get sued? This number is going up every time we poll it, and you'll see there's a lot of national press right now. And I feel most bad for our frontline healthcare workers who've literally put their life on the line to help protect ours, only to learn that, there's a tsunami of lawsuits coming. So again, Dr. Rifkes, I'm not going to ask you to comment on this at all today. It's really not why you're on the line. This is just a mirror back to our members of the Florida Chamber about what they're concerned about. And then also, we asked you, if you could ask Dr. Rifkes one question, what would it be? And I think what's important, I prefaced it here, but I know that Governor DeSantis has been, first and foremost concerned about health and safety ever since he had his first press conference on this. And Scott, it seems like every single time he was, at a microphone for the first month or two, it seemed like you were at his side, and I know he's relying on you for data on health and safety. So you can see what these three questions are. I'm not going to go ahead and read them now. I know we'll have plenty of time for it later. And then, Scott, before I turn it over to you, just a little bit of framework here. The way we've been looking at this for the last 2 months at the Florida Chamber is I'm also the national chairman of our Association of State Chambers, and I'm on the leadership of the U.S. Chamber. And so from day one, our strategy, much like Governor DeSantis has been working with the White House and with other governors, our strategy from day one has been, how can the national business community work with the White House? And then how can the Florida business community work with Governor DeSantis? And then how can we have 250 local chambers and economic development groups really helping to lead the common guidance at the local level? So if we take what Dr. Rifkes is asking with the CDC, the White House, and Governor DeSantis, and we can execute it at the local level where we have all 412 cities and 67 counties on the same page, then Florida has a big advantage both from a safety and health perspective, but also we have a fighting chance of getting our economy back going safely if we do all this in concert, sort of through collective action. I put this slide in here just to have here for later when we send you the slide deck out, but I'm always asked, hey, when are we going to go back to normal again? And I think there's going to be a next normal or a new normal that looks an awful lot like what's on the screen here. I hope nobody on this call thinks that it's how quickly can we, can I go out this weekend and not social distance, or, can I just throw my masks away and burn them? I don't need them anymore. I don't think any of that's true. I think we have a next normal here. Until there's a vaccine for this thing, I think we all need to be on guard. So, Dr. Rifkes, with that said, I was doing my best there to cover, a lot of material in a short amount of time. I, first of all, on behalf of all 22 million Floridians and a couple million companies in Florida, look, this is your life's work, right? You're a physician, and, you didn't sign up to be, leading the most important state in the country's efforts to keep everybody safe and healthy. But we're very grateful that you're in this role. I'm grateful that the governor's listening to you. And we have 10.5 million employees in Florida who, work for private companies. And we're all counting on following your advice and the CDC. So we're all in this together. So what I'd like to do is we'd like to hear from you. Maybe you can make some opening comments. And then as soon as you're ready, again, our members can go to the Q&A portion and go ahead and start sending your questions in. I already have several. So, Scott, the floor is yours, and then we'll go to Q&A when you're done.
All right, thanks, Mark. First, I really want to thank everybody who's on this call. This is so important as we begin to reopen. Certainly recognize the impact that this has had on those individuals who've had COVID-19, those who have lost dear ones, and also those who have been impacted in so many other ways about COVID-19. When I saw the results of your poll, obviously we are all concerned about this. This is a new virus. We're learning about new things every day. The world has not seen this type of an outbreak in more than 100 years, and the dislocation is just absolutely incredible on this. And I really appreciate everybody's incredible focus on reopening in a proper and safe way. so we can keep ourselves all safe. So in terms of, I just want to back up a little bit in terms of what COVID-19 is, because we talk about this a lot, but I just want to make sure people understand the seriousness of this virus that we're dealing with. So this is a new virus, which first hit the face of this earth before January. This is a respiratory transmitted virus, which means comes in through the nose, through the mouth, it's breathed in, and then will go to the lungs and cause a very severe form of pneumonia. This is particularly harsh in the elderly population and those who are medically vulnerable. This is a virus which really is quite serious. You know, if we look within the state of Florida, we have about a 3% mortality rate. If one compares this to flu, for flu it is less than 0.1%. And as we're learning more about it, it appears to be more contagious than the flu as well. So again, much more virulent and is more infectious. Because it is a respiratory virus, this really guides our mitigation measures. So typically when someone breathes out, even if somebody has COVID-19 is not coughing, we now know that it can go out in the breath. Typically when somebody breathes out, breath particles, water vapors will go about 3 feet. And so this is why we talk about covering our cough, wearing a mask, cleaning surfaces, because that becomes so important. In terms of the trends, I also wish to refer individuals to look at the Department of Health website, which is www.floridahealth.gov. This is a website where I'm extremely proud of our communications team and our epidemiology team for putting this together. We believe that we probably have the best website in the country. We've actually gotten shout outs from Dr. Birx, who's part of the White House task force. If you look at this, it'll show you the number of cases we have every day, and we've broken down at the county level. So look at that. In terms of where we are as of today, we've had 39,000 individuals who have been affected, nearly 7,000 individuals who've been hospitalized, and sadly, 1,600 individuals who've lost their lives to COVID-19. As I mentioned, that this is particularly harsh in the elderly population, which is why we've been so focused on nursing homes, and we continue to really make tremendous efforts to make sure that we're keeping it out of nursing homes. I wish folks to realize that of the 39,000 individuals who had COVID-19, the overwhelming vast majority of cases have occurred in the community. If we look at in terms of group settings between nursing homes and prisons, that makes up about 12% of the total number of cases that we have. So most of the cases that we are seeing are in the community. In terms of how are we tracking COVID-19, and again, you'll be able to see this on our website. And these were the guidelines that we had followed in terms of guiding reopening. So there are a few things we look at. One is we get information from emergency rooms for flu-like activity and also for COVID-like activity. And we've seen a steady downward trend overall in the state for at least the past 2 weeks. So we look at the number of cases we have every day, and then also the state has done a tremendous amount of testing, and by today we will cross the 500,000 mark. And we look at the percent positive individuals that comes back day over day, and actually today it dropped under 2% of the individuals we had tested the previous day. So this is the downward trend. We also look at individuals in intensive care units and on ventilators, and that number is dropping down. So we've seen a good 2-week trend in terms of percent positivity dropping, flu-like illness, COVID-like illness, and in terms of hospitalizations. And seeing these trends is what led the governor to move to the reopening strategy. In terms of measures, and these are things that guidance that your businesses can consider. Masks are very important, and this is because of the fact that we now know that before some individuals develop COVID-19, before they get symptoms, over the 2 days beforehand, they could actually spread virus at a higher level than even when they become ill. So we don't know when we're becoming ill. This is similar with flu. Typically, individuals, before they get flu symptoms, will spread the virus over the 2 days beforehand. So a mask will keep you from spreading it. Also, there are some individuals who have COVID-19 who don't know that they have it. These are asymptomatic, and a mask will stop individuals from spreading this as well. So this is why the importance of masks. Also, I was reading last evening, a new report came out where some people actually, so typically we're saying that a mask may not necessarily protect you, but will protect others, but I think there's evidence that has just come out from the healthcare community that a mask will actually help protect you as well. One of the best ways to avoid COVID is to avoid groups, which is why guidance is have groups less than 10, which gets to the issue in terms of restricting common access areas, coffee rooms, things like that, making sure that those are limited in terms of number of individuals in there at the same time, and spacing. In terms of screening workers, this becomes very important. If an individual is working while they're sick, they have the potential to spread COVID to others, which is why screening is important. I've seen sneeze guards, there's plexiglass materials at cash registers, a terrific idea in the event that a cashier may have COVID and not know that they have it, or that a patron may have it, and the fact that they're asymptomatic. Also, in terms of building capacity, having increased spacing within your work establishments. In terms of one of the phase 1 plans, it talks about businesses operating at 50% less of building capacity. Mark mentioned teleworking. Again, with phase 1, we are still, this is a gradual step. We're putting the car into first gear here. If individuals can continue to telework, particularly those individuals older than 65, those with underlying medical conditions, to make sure they're protected, that should be considered as well. And then you had also talked about masks and getting PPE. So it turns out the supply chain is getting better in terms of this, but if individuals can't get surgical masks, you can certainly make masks yourselves out of cotton. On the CDC website, they have instructions for this, and some of these are sold commercially. As far as testing, we talk about 2 major tests. One is the swab, either in the nose or in the back of the throat. This is a PCR test, which stands for polymerase chain reaction. This will tell you, is the virus actually present? And yesterday, we tested nearly 20,000 individuals in the state. This testing can be performed at drive-up centers, community testing sites. And I also wish to emphasize that every physician can order a test for COVID-19. And in each community, there is a site where individuals can be tested. Sometimes this can be at local hospitals. Some pharmacies will now begin testing as well. So, and then also our county health department is really proud of the job the county health departments have done. They will do testing, and each county health department is in the process of making sure that they can test a good portion of individuals in the community. We also heard about the antibody test. The antibody test will tell you whether you have had COVID-19, and we're still learning about how long these antibodies will stay around for and how long they will protect you. So more information will be coming about that. And the question is also posed about what should we do with the fall coming around. One of the things that we have to be cognizant of, this is typically when flu season starts, and COVID-19 is tough, and COVID-19 with flu will certainly be double whammy. So when it's time when flu season hits, to make sure that individuals also get the flu shot. So at this point, I'll be happy to take any questions that you have. And again, I really want to thank everybody for doing your part. Going into phase 1, we're putting the car into first gear. I wish to emphasize that COVID still is in the community. It's not just in nursing homes, assisted living facilities, and in fact, more than 85% of the cases that we are seeing for COVID are not in those areas. So it'll be in the customers walking into your store. Potentially could be in some of your employees. We need to keep our guard up, especially as we are going into phase one, so that we don't backslide. And again, I'm really proud of what Florida has done. One of the reasons that we have been able to get to this position is by the collective spirit and collective activities that we have all put forth. Thank you.
So, Dr. Rifkes, thank you very much for that, and I think that just gave our team a chance to see sort of the depth of knowledge and understanding you have on this. So here's what I wanted to do. We asked our members to dial in today really so that they could ask you questions, and we already have 21 questions in queue, so I'm going to try to ask them fast so you can answer them fast. And I'm just going to take them in the way that they came, okay? So we'll jump all over the board because it's in the order that they came in. First, there was a question about, you talked about this is in the community, and I wanted to thank you. I was getting calls, texts, and emails last week, and people were telling me, they were saying, since most of the cases are in nursing homes and prisons, you know, why are we doing all of this stuff? And I called you, and I was surprised just because I had so many emails on it. I think the day we talked, there were 36,000 confirmed cases so far, and you directed me again back to the excellent website that you have at the Department of Health, and you told me where to find it. But on that day when we had 36,000 confirmed cases so far year to date, there were 4,400 of them in assisted living or nursing homes or residential facilities and 400 in prisons. And so it ties directly to the numbers you shared today, and it also highlights, you know, misinformation is not our friend. And so, you know, nursing homes are doing a good job of this, but this is in the community. This is not a problem in nursing homes and prisons. This is in the community. So thank you for that. The first question here is from Kevin, and it says, since the incubation period is quite long on this virus with a fairly large window in the asymptomatic contagious period, how will we know when to proceed further in terms of steps in reopening safely without a regression?
Yeah, thank you, Kevin. Important question. First, as far as the incubation period, on average, it is 5 days, and the outside window is 14 days, which is why if somebody has been exposed to COVID-19, we have them self-isolate for 14 days. We follow, and you can also follow along with us by looking at the Department of Health website. We're going to look at a number of different things. The number of cases that we have, the percent positive results, those cases that come back day after day, flu-like illness and COVID-like illness. So the first thing I do every morning, I pull up our dashboard and I look at everything county by county, as do other members. So by looking at these measures, it will give us information, and we'll continue to look at information from the hospitals about whether individuals are being hospitalized for COVID-19.
Okay. Thank you. Scott, next question. You know, this is probably the governor's decision, but it has to do with gymnastics schools, and the question comes from Clara, and the question is, do you think a gymnastics school could be open in phase 2?
This is, like you mentioned, this is one of the things that the governor is looking at. I would say that the governor is looking at this in a very, very thoughtful manner, using evidence-based approaches to guide these decisions, and that information will be forthcoming in terms of timeline for that.
And whenever that decision's made, I would imagine back to the issue of guidelines, CDC guidelines and health guidelines, whenever it's deemed okay to open, I'm sure that every industry, whether it's a gym or a fitness studio or a gymnastics school, is really going to first and foremost need to make sure they understand what those safety guidelines are as well, right?
Absolutely. Again, by understanding the biology of this virus, its respiratory transmission, a breath will typically go about 3 feet. Again, the best way to avoid COVID is to avoid crowds, following the guidelines we talk about. These are the general principles that will protect us all.
Okay. And Scott, thank you. The next question, Dr. Rifkes, has to do with large group meetings. And again, I know this is complicated, but we have, so there's almost 4 million cases, confirmed cases in the world, 3.8, I think, when I looked last, and about a third of them are in the United States. And there's a question here about large group gatherings, and I sort of want to give a little flavor to it, Scott, because Florida, we don't have an income tax in Florida, in large part because of our tourism economy. And, we have 130 million visitors to Florida every year thanks to Visit Florida's work, but 14 million of our visitors are international visitors. And, we have almost 4 million cases in 187 countries. And so I know that's a lot of data to throw out there, but it makes the answer to this question complex. And the simple question is, from Lisa, and it says, Dr. Rifkes, when do you think Florida will open group meetings of around 4,000 people, such as trade shows?
Yeah. I don't have an answer to that, but I will say that, you raise some, with that many visitors, with this being around the world, with this being in domestic hotspots, one of the things that we recognized early on where COVID-19 was coming into Florida from, initially, it was from Europe, then we saw other areas of the United States, and we have been very proactive in trying to stop the introduction into our state. So we don't have an answer to that question. We'll continue to look for CDC for guidance with that, but there will have to be a significant reduction in numbers of individuals outside of Florida with COVID-19.
Thank you, Dr. Rifkes. And I'll just say, in my hat as the national chair of the National Association of State Chambers, this question comes up on both of our weekly calls with all 50 state chambers and the U.S. Chamber. It's on the top of everybody's mind. This is not a unique to Florida challenge. It's like you say, this is a CDC guideline that all 50 states are really trying to solve together. There's a question here about Broward County. Why don't we save that question, because I'm sure there's going to be questions about the 3 counties, opening back up, and maybe we can just cover that in a little while. There's a question, let me go here, just bear with me here. Some of these have been asked already. Scott, here's one that comes from Janet, and it has to do, it says the White House press secretary this morning apparently said, and Scott, I did not hear this, so I'm just taking this at face value from Janet. It says the White House press secretary stated that widespread testing is not the answer because someone could get tested this morning and pass, but by tomorrow morning they could become infected. And they're wondering what your thoughts might be on that situation.
Yeah, first of all, we've said from the very beginning that, testing is not a vaccine. Testing informs us as to who might have COVID-19. The public health measures to keep us from getting COVID-19 are exactly what we've talked about: our social distancing, our physical distancing measures, wearing a mask. Testing, though, is very important because if we identify an individual who has COVID-19, then where we'll bring in our contact tracers. They will identify who that person was in contact with in the previous several days, previous week. And we're concerned if individuals have exposure for more than 10 minutes, being within 6 feet of an individual, and then we will have that individual, those contacts, isolate for 14 days. This is how we break the chain of transmission. So testing ends up becoming really important in terms of breaking the chain of transmission, and also for your workers. If you have workers who are coming back, they might have the flu, they might have another virus which can cause a cold, but if they have COVID-19, you certainly do not want them working in your workplace. They could be exposing your patrons, other workers, putting them at risk for this illness. So which is why it's important that we can be able to have testing at the degree that we have in the state. And the state has made tremendous progress in terms of the number of individuals we're testing every day, and we'll continue to expand that.
Scott, thank you for that. There's a couple questions that have come in on masks, and I'm just going to ask them both. One is, is it mandated that you wear a mask when you're in public? What are your thoughts on wearing masks in public? And then the third question that's similar is, since masks are hard to find, will a covering such as a bandana be as effective?
Yeah, thank you. First, in terms of things you're talking about, these are guidelines. And so guidelines that are evidence-based guidelines to follow. So in terms of surgical masks, these are becoming more available through the supply chain. If you can't get surgical masks, you can actually make a cloth mask yourself, and some of these can actually be sold. And the CDC has a website in terms of how to do it yourself masks. And then in terms of bandanas, this is actually one of the things that actually is commented on the CDC website, where you can take a bandana and actually put a coffee filter inside of it as a face covering. Wish to emphasize that when people wear masks, it's important it covers both the mouth and the nose. And then in terms of the utility of this has been proven in other countries as really significantly reducing the spread if it's worn by many individuals.
Thank you, Dr. Rifkes. Quick question here on long-term effects of COVID-19, and the specific question from Ardith is, what do we know about the latest information on what the long-term effects may be on individuals who've had COVID-19 and are considered recovered?
Yeah, so that's a really interesting and important question. Like I said, this is a new virus. You know, our experience with COVID-19 is 4 months old, and we continue to learn about this virus. So there's some individuals who've been on ventilators, and these individuals may have long-term residual lung problem, where they're going to have to go through therapy related to this. We now know that some individuals that it can cause blood clots, where individuals may have strokes related to this, and they'll need different forms of therapy for this as well. So again, this is why when individuals who have COVID-19, it's important that they have medical care, and really grateful to our medical community for taking care of the almost 7,000 individuals who've been hospitalized for COVID-19, taking care of them acutely, and then also continuing to follow them after their discharge home.
So, Dr. Rifkes, there were a couple questions in there on masks, and I have a lot of questions in here on testing, and there's a lot of conversation going on about schools, both K-12 and the universities and our great state colleges. And Scott, I know you know our colleges and universities have been ranked #1 in the United States for 3 years in a row. But someone was talking with me the other day just about testing, and there's a couple questions in here, so I'm going to try to wrap them up into one question. I think we're on day 67, we said, since our first case in Florida. And today, I think we're going to hit the 500,000 mark of how many people we've tested in Florida in 67 days. And there's been a lot of innovation. You know, we're getting more tests done in a day today than we did 60 days ago. But relative to universities and colleges, just to give scale to this, and so I'm going to wrap these questions into one, it's taken almost 70 days to test 500,000. If you just take the 12 public universities that we have, the 420 or 30,000 students and the 75,000 faculty, you know, there's about 500,000 faculty and students, not counting the state colleges or the private colleges and universities. So we're beginning to get questions here at the Florida Chamber about, you know, are we going to test 500,000 people? And if you tested them when they came back, and you tried to do that all in 24 or 48 hours, you know, how would all of that happen? And you may not have all the answers to that, but I'm starting to get a lot of questions on that, and I'm just curious how we might think about that.
Yeah, thank you. So first of all, in terms of what recommendations are for testing, the CDC has different recommendations out there as far as testing. And at the present time, the CDC is not recommending broad testing of asymptomatic individuals, which really brings us back to the importance of screening, which I talked about before. So if an individual, whether it's school, university, or the workplace, that individuals should look, do I have a fever? Am I sick? Do I have a cough? Do I not feel well? So if an individual is in those categories, certainly the individual should not go to work, should not go to school, and should consider getting testing. So if we do testing based upon symptomatology, that way you're not testing 500,000 individuals all at once. So that's really what the current guidelines are, focusing on symptomatic testing in that vein.
Okay. Speaking of asymptomatic, we have a question. From Anna that says, if someone is asymptomatic and they're not coughing or sneezing, how can they still spread this? Can they still spread the virus, and how would they?
Yeah, Anna, that's a really important question. And like I said, this is a new virus we continue to learn about. And one of the things that came out more than a month ago was that individuals who are asymptomatic can actually breathe out the virus just by exhaling, not necessarily even having to cough and sneeze. When we became aware of this more than a month ago, this is why we ended up asking individuals working in long-term care facilities and nursing homes to wear masks. I believe we were one of the first states to make that ask of this type of worker. So this is why it's important when individuals are in public, certainly when individuals are around the vulnerable population, people over than 65, those with medical conditions, that they wear masks.
Okay, thank you. Dr. Rifke's a question about thermometers and taking temperature, and there's a question in here that says, are the forehead type thermometers accurate and widely available?
Yeah, so many of the forehead type thermometers are actually very accurate, and again, there actually is guidance posted online as to which ones are accurate, and in terms of availability, these are present in the marketplace.
Okay. A question from Jim on whether a person can catch COVID-19 more than once.
Yeah, good question. Actually, I'm going to go back to the thermometer question. So we're at the Emergency Operations Center, and so every morning when we come in, I have my temperature taken, and then we actually go through a set of screening questions. And the screening questions are as important as taking the temperature. They basically, they ask, am I feeling ill? Any changes over the past few days? Have I been in contact with a person who may have had COVID-19? So the basic screening guidelines, and I should also point out that on our Department of Health website, our communications team, which really is fantastic, they made a number of infographics that you can download for use in your establishment. And then the question comes, can you get COVID-19 several times? This is a question that is being looked at. Some people thought that you might be able to get COVID-19 a few times. I would say the jury is still out on that, and based upon the information which has been published about that, if that happens, the chance for that is probably going to be small. But again, this is a new virus that we're continuing to learn about.
Okay, thank you, Dr. Rifke's. Next question comes from Rick, and the question has to do with contact tracing. It's a long one, so bear with me. I'm just going to read it verbatim. It says, on contact tracing, is this being managed at the state level, or are we relying on cities and counties to put their own systems in place? And then the second part of the question, Scott, it says, either way, what's the best structure and process to accomplish this, and how important is contact tracing to our ability to keep our cases down going forward?
So I'm going to start with the last question first. There was an article earlier this week on the newspapers talking about the cases in Florida, saying was it due to planning or was Florida just lucky? And I think that first, either way, it's good that we're in the position we're in now. And I really think reflects our public health measures right from the very beginning and through now and until this ends. We will continue to do contact tracing. Early on, we recognized how important it was to stop person-to-person transmission. And every day we're contact tracing at least 1,000 individuals. And again, what this means is identify the person who has COVID, identify their immediate contacts, tell their immediate contacts who've been within 6 feet for more than 10 minutes to basically isolate. So we've been doing this from the very beginning. This is something that happens at the state and county level. So Florida has an integrated system of county health departments. We have 67 county health departments. Each health department has epidemiologists. And so the cases within each county health department, those are contact traced by the epidemiologist within that health department. Early on, knowing that we're going to need more individuals to help with contact tracing, we actually partnered with the Schools of Public Health, and we have several hundred students who joined us from Schools of Public Health along with faculty members to assist in contact tracing. And at the present time, throughout the state of Florida, we have more than 1,000 individuals who are performing contact tracing. So this is something that happens at the local level and is something that is guided and monitored at the central level.
Okay, thank you, Dr. Rifkes. There's another question here about taking temperature, and it says this is from Ardith, and it says, when taking a temperature, what's the temperature at which it becomes concerning, since 98.6 is only an average for people? Yeah,
so, it's interesting in medicine how things can vary. So typical temperature, when I had my medical training, they said we didn't consider a fever until it was greater than 100.4 degrees. Some people use that benchmark. Some people will use 100. Some people will use 99.6. So I would say that the floor would be 99.6.
Okay, thank you. We have a person asking about international travel, and they said if they've already had the virus, would it be safe for them to travel abroad?
So at the present time, there really is not much international travel which is going on. If the individual has had COVID-19, then if they still have antibodies against it, the odds are that they will remain protected. But again, this is a new virus. We're still learning about how long the antibodies last for and how long antibodies will be protective for. So I think at face value, we are going to find that individuals are protected, but in terms of how long that protection lasts, we don't know for this virus.
Okay. Scott, I'm going to ask a couple in rapid fire. I know we're going to run out of time here.
Okay.
A question about returning to work. So this one's from Belinda, and it says, when can our employees return to work? Is it after no fever for 72 hours and the symptoms have subsided? Is it 7 days after they're completely healthy, or no fever for 72 hours? So I think the question here is, if someone's had COVID, when can they return back to work?
Yes, thank you. That's an important question. And again, on our Department of Health website, we have infographics about this. So if somebody has had COVID-19, the CDC guidelines are that 10 days from the time they first develop symptoms, and they have to be, or it could be within this 10 days, 72 hours fever-free, not taking antipyretics like Tylenol, and that their symptoms have markedly improved related to cough. Okay.
I have a question here from Virginia about asymptomatic carriers versus those in the hospital. It says, is the virility of asymptomatic carriers any less virulent than symptomatic people or hospitalized people?
Yeah, that's a really important question. And in terms of how individuals spread the virus, it is really interesting. So there's this concept of super spreaders. So the average person with COVID-19 can spread the virus to 3 or 4 people. Super spreaders are individuals for certain reasons will actually exhale much more virus than the typical person. And asymptomatic super spreaders can occur, and they could actually spread the virus to as many as 20 individuals. So we don't know exactly who's a super spreader and who is not, but there are individuals who are asymptomatic who could actually spread much more virus than somebody who is hospitalized with a more severe case.
Wow. Scott, there's a question here about the keys, and it says, I don't hear much about the keys. How are their numbers?
Yeah, so again, I would like to refer everybody to www.floridahealth.gov, and you can look at the numbers for the Florida Keys in Monroe County. In this county, we're seeing decreased numbers of flu-like illness, influenza-like illness, percent positivity, and in terms of number of cases.
Okay. Let's see here, Scott. I'm gonna scan through these. Many of these have already been asked. You know, some people want to know if we're going to have college football this fall. I'll let let somebody else figure that out. Can the virus be spread through the ears and eyes?
A good question. I'm not aware of that. Again, this is a respiratory virus, which typically will go out with a breath, cough, or sneeze.
Okay. Question from Rindy is, if our workplace can have an office set up 6 feet apart between employees, and we can also accommodate telework, can we bring everyone back to the office now?
So again, I'm going to go back to the basic measures. You know, spacing 6 feet apart. That sounds excellent. Screening workers when they come to work. That's something which is needed. And then teleworking, particularly for those individuals who can, for those who would be in the mentally vulnerable situation, or those 65 years of age and older.
Okay. Scott, we have a question from a licensed massage therapist, and this person, she says she's thinking of a career change and is interested in actually doing contact tracing. Where could she go to find job postings and learn more about that?
So first, this is a pretty specialized area in terms of what contact tracing is. We'll have to look and see where their training programs for contact tracers.
Okay. We'll follow up with you, and we'll post that on our website, and you might as well. Let me see. I know we're Scott. Some people are giving accolades to the Department of Health and how good your website is, and they're asking if you'll repeat it again for everyone.
Yeah, thank you so much. It's www.floridahealth.gov, and then you'll see a link there to COVID-19. And when you go to that website, you'll see an interactive dashboard where you'll be able to scroll over each county and then actually go down to the zip code level. You'll be able to download situation reports from each county, and then at the state level, and also see information about long-term care facilities as well.
Okay, Scott, we have so many more questions, but I'm gonna just ask one here, and then we'll wrap up. Okay. There's a question. Someone's asking if you will again compare the difference between the regular flu and COVID-19. It says, I'm not going to read the whole thing, it's long, but it says there's a lot of different news and opinions that say the flu is actually worse. Can you give us, what the opinion is of what the difference is, what we know about it?
Yeah, so just to put things in perspective, the flu season this year, we had 12,000 individuals in the United States who died from flu. I believe we're more than almost 70,000 individuals in the United States so far with a pandemic that is still going. In terms of the mortality that we're seeing in Florida right now from COVID-19 for cases, we're at 3%, which is significantly higher than the flu. And initially, it was thought that COVID-19 was modestly more infection than influenza, but it appears to be at least twice as contagious as flu. The other thing that's different with flu is flu often will hit people at all ages, but this appears to be especially harsh on the elderly and medically vulnerable population. So this is a much, much more serious infection than the flu that we've seen this past season.
So, Scott, I said no more questions, but I just got one. I'll sort of give you this one here at the end. It says, would you fly to Oregon for a golf trip with your 68-year-old, otherwise healthy father at the end of the month?
Well, since I don't play golf, you know my answer to that question.
Got it. Okay. Well, I want to thank all of our Florida Chamber members for dialing in here. Dr. Rifkes, I know you're in incredibly high demand. The governor's probably waiting on you right now for advice, and we appreciate you working with us today on this. I want to give you the last word, Dr. Rifkes, but I want to let you know we're going to send out an update today, and we will make sure right at the top that front and center is the Department of Health's website, as well as every day when I send an email out to our members, we have a link to the Department of Health website. It's incredibly important. We refer to it nationally. And again, we just want to thank you for what you're doing every day to help protect all of us. And so I'll give you the last word.
Yeah, first, I want to thank you, Mark, for putting this together. I want to thank everybody for being on this call. There's been a lot of press about why the projections of more than 7,000 people by this time didn't happen, why we did not have as many individuals hospitalized. And I think this is a real tribute to the state of Florida, a real tribute to all the individuals who have been working on this. From the very beginning, we started planning for this, for COVID-19 in January, and I'd like to think that the reasons that of course, I couch it. I feel badly about the people who've gotten COVID-19 and those who've lost their lives. So this is something that we've made progress, and we absolutely need to keep our guard up. So thank you for keeping your patrons safe, keeping your workers safe, and most of all, keeping you and your family safe. So happy to help in any way we can going forward in terms of providing guidance.
Okay. Dr. Rifkes, thank you so much, and thanks for all that you and Courtney and the whole Department of Health are doing for Florida. We're all with you, behind you, and thanks so much. We actually have over 60 questions. We didn't get to all of them, but we'll follow up with you later offline. And thank you so much, and thanks to all of our members for joining in today. Take care, and God bless.